The following is an encore presentation of a pre-recorded program. To join one of our many live presentations, please visit cje.net/events, call 773-508-1000, or follow us on your favorite social media platform.
Hello, my name's Roseanne Corcoran. I'm manager of CJE SeniorLife Counseling Services, and it's my pleasure to welcome you to this Insights on Aging program entitled The Importance of Addressing Basic Legal and Housing Issues. If there are any professionals in attendance today, I want to let you know that right here at the start of the program, we do not offer professional CEUs for this program. These monthly community education programs are part of an effort by CJE and our Counseling Services program to highlight important aging and mental health issues. Our goal is to provide essential information to the individuals and families that we serve. Please be aware that all our programs are recorded and that they're available on our CJE SeniorLife website. If you go to the Counseling Services page, there is a tab that says Insights on Aging. Since this program is recorded to be shared publicly, we use higher privacy features and your live participation is anonymous. You will not be able to see other participants, and when you use the Q&A feature, your name will not be shared. We do encourage you to participate and to use that Q&A feature. So at the bottom of your screen, there's a button that says Q&A. That's how you can ask questions of the speakers. The chat feature that many people are more comfortable using is disabled, and it's only a way for the host to send you messages during the program. As a host, I'll be monitoring the Q&A and I can alert the speakers if there are any issues that arise during the program and that they should be addressed sooner than later. Otherwise, the speakers will talk for the first 45 minutes of the presentation, and then they'll take questions at the end from you. The PowerPoint presentation that you see during the program will be shared with you who are participating in the program live on its original date. And also we'll send you a recording of this program. We'll send you the link. It might take about a week for us to get this all ready, so please be patient. Before we start the program, I want to mention that CJE SeniorLife Counseling Services does offer a full range of older adult behavioral health services. These include individual supportive counseling, psychotherapy, support groups, as well as family and caregiver support. All of these services are presently available through telehealth, either online with video or on the telephone. We're also now offering some limited face-to-face sessions on a case-by-case basis. With all that said, let me now introduce our speakers for today. I'd like to introduce Tamara Kushner-Groman, who's an attorney and the manager of CJE SeniorLife's Consumer Assistance Program, as well as our new legal help desk. Also helping with today's presentation will be Rachel Latham, who is also an attorney and a research scientist working with CJE's Research Institute. With all of that said, I'm going to turn the program over to our quite qualified presenters. Thank you.
Good morning, everyone. Thank you for being here. I'm going to go ahead and start the PowerPoint in just a minute, but first I want to give one small introduction, which is to tell you that while we will cover legal topics today, I want to make sure everyone understands that legal advice is really important to be taken on a case-by-case basis. And while today I will be giving an overview of several different legal areas, if you are looking for legal guidance for your situation individually, I would love to hear from you one-on-one. We can set up a consultation and I'd be happy to provide you individualized guidance in that way. I am going to go ahead and start our PowerPoint. I hope. There we go. I'm so proud today to be speaking together with Rachel Latham. Rachel and I together created this amazing program called the CJE Legal Help Desk. I'm just going to give a little bit of an intro and then turn it over to Rachel to do some of the presentation, and I'll come back in a few minutes. As many of you know, CJE SeniorLife is a nonprofit elder care provider. We provide assistance to so many people in our community. And I want you to know that it's not just the older adults we provide assistance to, but often their caregivers or their families. And that is also true of our legal help desk. We often support adult children in many different areas. The values of CJE of respect, advocacy, compassion, intention, innovation, and accountability are all areas we take into consideration when we were looking to create this legal help desk and all of our other CJE departments that help support our amazing programs at CJE. So CJE has some amazing community services, and I would be remiss if I didn't mention them because so many of these services actually apply directly to legal needs and housing needs. CJE Community Services, certainly Roseanne mentioned our amazing counseling department. And I'm going to mention it again later in the presentation. We have our care management services that can be present in the home with older adults to help make care plans and organizational decisions about aging in place and about care in the home directly. Our community engagement department is bringing you all those amazing cyber club programs that if you're not familiar with, hopefully you'll head on over to our website to see. If you're interested in getting involved with our volunteer department, I know they are looking for drivers for home delivered meals and other programs. Our consumer assistance department helps with all kinds of consumer benefits. This can include just concluded open enrollment. They are SHIP certified. This can include SNAP benefits, public housing, all sorts of additional assistance that can be needed. Our adult day services, while our Evanston location is currently under construction, our adult day services are continuing to meet in Skokie. And our adult day services offer programming for older adults with mild to moderate cognitive impairment. Also, in certain areas, transportation is included. And as I mentioned before, we have home delivered meals. And last but not least, my personal pride is our legal help desk. So our legal help desk offers free legal assistance to adults age 60 plus or those who care for the adults age 60 plus. And we really offer a holistic approach to legal problems. I'm not going to get too much into those details because Rachel's really going to go into that. But I want to just also emphasize that while there are a lot of legal aid organizations that have income limits to who they can support, our legal help desk, which is generously funded by RRF Foundation for Aging and also the Niles Township government, does not have income limits. So we are able to support anyone who needs legal support. I am going to turn it over to Rachel Lessam, and I'll be back in a few minutes.
Great. Thank you, Tamara, for getting us started. So as Tamara mentioned, this is our legal help desk, and we based it on a medical legal partnership model, and that may not be familiar to many of you in the audience. The medical legal partnership is based on the idea that there are factors that can affect our health and well-being that our doctors and other healthcare providers simply can't address. And one of the key components of those are legal services, that there are legal resolutions to sometimes intractable health problems. And this was how the first medical legal partnership actually was established in Boston in 1993 by pediatrician Larry Zuckerman. He found that he had some clients with severe asthma problems who kept showing up in the ER with exacerbations, and they were being treated according to all the best protocols, and yet they kept coming back. Why? Because there was mold in the apartment, or maybe their utilities had been turned off. And as a doctor, he had no way to handle those problems. He couldn't address those problems. So he teamed up with some lawyers who could take the landlords to court, perhaps, and resolve the issues and have repairs made, have utilities turned back on so that his patient's health improved. And over the years, MLPs have increased the overall well-being and quality of life for their clients. Next slide, please. Oh, I think this, yep. So here's our CJE Legal Help Desk. And what's beautiful about our approach is we are unique and innovative in that we have housed our legal help desk not at a hospital like the original MLPs and many of them out there, or healthcare center, but in our social service agency, so that we get referrals when we have someone come into the legal help desk. They can be referred to all the community services that Tamara mentioned at the opening, and also that the people who are already receiving those services can also get legal help as needed. We also can have community members come straight through us, and we also have established partnerships with outside providers who can increase the ability of the legal help desk to meet everyone's legal needs and resolve their legal problems. So if you could go to the next slide, please. Oh, you are. One of the reasons MLPs or our legal help desk can be so successful is that they deal with the social determinants of health. It's a pretty unique term, and it means that a person's health is not just determined by their behaviors or the healthcare services they receive or the quality of the medical care, but it's determined by social factors. It's shaped by our environment, and it's often rooted in complex problems that come out of law and policy. So that really ties into this idea that not all healthcare and not all well-being can be addressed by the healthcare system, and where legal services can really come into play to enhance people's well-being and quality of life. Next slide, please. And this slide just indicates that 60%, the largest part of the pie of a person's health, is determined by these social factors. So when legal issues are addressed, their outcomes beyond the resolution of your legal problem. You can have lowered anxiety and stress. There have been fewer hospital admissions, greater overall physical and mental well-being, and a greater quality of life. And you can move to the next slide. And conversely, we know that health suffers when our legal needs go unmet. When you have a legal problem that hasn't been addressed, or that you may not have even identified yet, because not everyone knows they have a legal problem when they do, then it can lead to pretty severe consequences, like increased anxiety and depression, like living in an unsafe house, or having to ration your money in a way that keeps you from having adequate food and medication. And this is where the legal help desk really comes in, and legal services really come in. You can go to the next slide. So we like to use the mnemonic of I help, which identifies the domains of those social determinants of health that I mentioned. So the first of these is income and insurance. Next is housing and utilities, education and employment, legal status, personal and family stability. And all of these can be addressed by legal services and can affect your health. And today's presentation, however, we're going to focus primarily on the housing aspect. So housing, how can legal services help housing, and how can those legal services affect your health? Well, first and foremost, a stable and decent home helps people avoid costly emergency room visits, either related to the lack of safe housing, an unsafe condition in the home, or even in extreme circumstances, homelessness. Next. Also, consistent housing and heat and electricity helps people follow their medical treatment plans. We know that people with vulnerable health can be affected adversely by extremes of heat and cold. So legal services can help prevent utility shutoffs. They can help prevent evictions as well, and allows people to meet their own needs for health and well-being. The four components of housing that are really critical, and that Tamara is going to go into in more detail, are that your housing should be safe. It should be comfortable. It should be appropriate for your needs right now, and it should be affordable. And starting with safe housing, for example, your housing location where you live should be free from illegal activities. It should be free from mold. For like in the asthma example I mentioned earlier, it should be appropriately heated and cooled. And you should have working smoke detectors. Additionally, for example, if you are using your oven for heat, that is not a safe environment. And it's important that your housing be safe long-term. And often there are legal resolutions and legal ways that we can help that to ensure that happens. And I'm going to pass it back to Tamara, who's going to continue.
So when we think about the different areas that Rachel just mentioned, that it should be safe and comfortable, etc., a lot of these questions, while they're very easy to talk about, they can be harder to put into practice. And so, for example, when we're talking about a house that should be comfortable, right? I want my home to be a place that's easy for me to come home to, right? If I need to navigate my home with stairs, right, to get into my house, is it hard for me to physically get in and out of my house? What about, is there space to walk around the bed? Is there clutter in my home? When I come home and look in my various rooms, right, do I feel overwhelmed by what I see, or am I happy and comfortable and content to be here? And certainly in the last 2 years of this pandemic, when we've all been spending a lot more time at home, these questions certainly arise. And if you are living in a space that isn't comfortable, right, then we want to start asking why. Why is that? Is it because there could be a myriad of reasons why I continue to live in this space? And here's one of those spots where I'm going to put in a plug for our counseling department, because if your home feels overwhelming to you, then one of our licensed clinical social workers can really help work with you to figure out why it is that this is so overwhelming. And perhaps one of our care managers can make a care plan. A couple other things I want to mention is, for example, can you fit a chair in the kitchen while you cook, right? This is just one of those things that, are your chairs too heavy? Are your chairs on wheels? Are they steady? These are some of the questions you might want to ask yourself about being in a comfortable home. I am nearly sure that all of you have heard this phrase called aging in place. This is a hot topic, right? Everyone wants to age in place. But one thing I want to sort of address is that aging in place does not necessarily mean staying in the home you currently live in. It may mean that, especially if you can put some modifications in place. But what it definitely means is aging in a place that is conducive for my needs without needing institutionalized care. It might mean asking yourself, is this home appropriate for my needs, right? Does my home have stairs, either to get in and out of the home or to go up and down the stairs? I live in one of those typical 1950s split levels, right? A lot of people live in these homes that were built as split levels, many of which do not have a bathroom on the main floor, right? So in the event of a knee surgery or any other kind of debilitating physical factor, how are my needs going to be met in my physical space? Do I have to bring my laundry down a load of stairs to get to my washer and dryer, right? Or is there an elevator in my building? And it doesn't necessarily, even if your laundry is in the basement, that doesn't necessarily mean you have to move immediately. It might mean considering putting in a lift, a chair lift, so that you don't have to navigate the stairs, or putting in a laundry chute. So again, this is one of those areas where I say it's much easier to talk about than to do, But one of the best things about my job running a legal help desk is that I have an entire social service agency behind me to support all of the myriad needs that I may bring up in a legal context. This next part about being affordable is really the major things that I want to discuss today. And this is certainly the area where, as I mentioned at the beginning, I'm going to be talking about a lot of different legal things, but to really get guidance on your own personal home, right? Don't just take what I say and go run off and do it. Let's set a time to talk about it and see which of these areas might make sense for you. So first, what does it mean for a home to be affordable? So the old rule of thumb was always that your home should not be more than 1/3 of your income. However, that may or may not be true for everyone. We always need to take into consideration, as Rachel said, food, shelter, and medication. These are the big three, right? All three are absolute necessities, right? If you're needing to cut pills in half to extend the life of your medication because you have to choose between refilling a prescription and getting food this month or paying the rent this month, then that is an absolute time to call CJE. See if our consumer assistance team can find additional benefits that you might be entitled to get more support. Food, shelter, and medication should never be compromised. So practically speaking, what is affordable? Every income level needs a budget. Every income level, right? None of us know how long we're going to live, where our assets could run out, or will they last us as long as we want? And also, the nice thing about having a budget is designating funds for specific tasks allows you to spend without guilt. Want to go to the hair salon? Want to buy the tickets to that show? If you know that you have designated the funds for that specific task, by all means, you can fully enjoy it. The other thing that needs to be considered with what is affordable is, are you financially prepared for emergencies? So whether you can set aside a few dollars a month or a more substantial amount each month, knowing that if and when an emergency comes up, you will be more likely to be prepared for it. Financial emergencies come up all the time: car repairs, appliance replacements. If you own your home and you're in a condo or you're in a planned community, you might have an increase in assessments or special assessments, and you might only get a month or two notice for those increases. And certainly major medical bills can come up. So there are many places to go for emergency financial assistance, but it's nice to know that if you have a little bit of savings, right, you can weather some of these more challenging times. What if it isn't affordable? Which is true. There are many people who have to manage on a very strict budget. And what if I'm already receiving some benefits? What should I do next? What if I am cutting my pills in half? What if I'm finding that I need to go to the food pantry more than my allotted time? The first thing I would say is contact CJE for a benefits checkup. Am I receiving all of the benefits to which I'm entitled? Am I receiving SNAP, LIHEAP? Did I get my property tax freeze? Am I getting the best Medicare and Medicaid plan for me? Those are some of the questions that you can ask the staff at CJE. You can definitely ask me. I am not a benefits specialist, but luckily I am supported by a team of amazing benefits specialists. So this is definitely an area to think about when it comes to your housing. The next area I'm going to talk about to continue on this question of what happens if it isn't affordable, I'm going to be talking both about rentals and home ownership, because the way we approach each of these is slightly different. These days, you're probably hearing on the local news evictions are happening, and they are happening all over Cook County and Lake County. It started, and it can be a very scary and nerve-wracking time. First of all, one of the most important things is to try to get legal help early. You can absolutely start with a call to me, and I can get you the references that can help you in court. There are also, there's an amazing new program that is in Cook County called ERP, the Early Resolution Program. And the courts are staffed with lawyers who are trained in this early resolution program. And this is where a lawyer will help an individual navigate and try to come up with a compromise with a landlord. It is very important, if you get any court documents that have dates or phone numbers or Zoom links on them, to attend the hearings if at all possible. Now, most of these judges are conducting the hearings by Zoom, but there are telephone call-in options. And if all of this feels really overwhelming, it might actually be easier to go to the courthouse and ask for assistance by one of these ERP attorneys who can set you up at a computer, make sure you're in the right courtroom, right? Even if it's virtually. And when you do speak to the judge, the first thing you can do is ask for more time. Say you're looking for legal assistance, and most likely, especially a first time and possibly a second time, a judge is likely to give you that time. Finally, while I won't go into all the details about it, there is, again, rental assistance available, and emergency financial assistance is available from several locations in Illinois. When we're talking about home ownership, it's a little bit different. When we're talking about home ownership, if you have a mortgage, loan modifications are far easier than in 2008. Anyone who tried to get a loan modification in 2008, 2009, it was crazy. You had to send in your documents, and then they said they didn't have your documents, and then you had to send in your documents again. It was a lot of back and forth. Nowadays, the banks have gotten much more streamlined in their process for loan modifications, and they are much more likely to engage in the discussion. If you're being asked by your bank, if the loan modification they've offered you is acceptable to you, you are welcome to call me. I can review the loan with you. We can discuss the terms and if it's appropriate for you. One thing I do want to make you aware of is think more about the big picture if possible. And I know it's not always possible, but if possible, think about the big picture, not just the month-to-month cost. Think about the loan terms. How much longer am I going to have to be paying for this mortgage? If I'm being offered a refinance, how much cash am I taking out? Because that affects the equity I'm having in my home. And if all of these words I'm saying feel overwhelming to you, please call me and I am happy to go through it. We'll talk about what all these terms mean in more detail for your specific loan. What happens if a foreclosure is filed? Well, I'll tell you, the foreclosure process is a long one. It's at least 18 months. And if a foreclosure is filed, you, the homeowner, continue to own your home throughout the entire process. That means you can sell your home throughout the entire process, which is an important piece to know. Just because a foreclosure was filed doesn't mean you've lost your ownership rights or that you can't sell it. You would have to then pay the bank what they're owed, but if there's any additional equity in the home, you would be able to take that money. If you live in a condo or planned community with assessments, pay those first, even while you're in foreclosure. Now, this might feel counterintuitive, but condo boards can evict a homeowner, sorry, condo owners can evict an owner, I am sorry, I'm getting all tongue-tied. Let me try that one more time. Condo boards can evict a condo owner for failing to pay assessments. And the eviction process is much faster than the foreclosure process. So continue to pay your assessments even while you're in foreclosure. Then, if a foreclosure is filed, consider all your options: loan modification, moving, and keep in mind there are many locations that can offer you assistance with moving costs and even packing up your home and downsizing and going through your stuff. There is assistance available for these things. And one additional option is bankruptcy and reverse mortgages. Bankruptcy. I know for many people, the thought of bankruptcy is an absolute last resort. And I want to just change that thought a little bit because bankruptcy laws were actually designed to give individuals a fresh start. So how do you know if a bankruptcy is right for you? The first thing I want to tell you is please don't take any guidance from anyone who's advertising on late night TV. Bankruptcies, there's two main types of individual bankruptcies. There's a Chapter 7 and a Chapter 13. So in a Chapter 7, your assets are sold to satisfy your debts. Well, that's a bunch of legalese to say, to the extent you have items of value, that could be jewelry, it could be automobiles, it could be a home with equity in it. Those items are sold and the creditors are paid off. If you don't own anything of real value, so for example, a person who rents where they own, drives a car that's a bunch of years old, might have a little bit of jewelry or furniture, but nothing that's of substantial value, that person, the bankruptcy court, the trustee won't have anything to sell. And therefore you will get a discharge of your debt. So Chapter 7 is really a benefit to someone who might have unsecured debt, such as credit card debt, right? Unsecured debt means there's nothing that can be taken away if you don't pay the debt, right? For example, a mortgage is a secured debt. If you don't pay your mortgage, the mortgage company comes to take your house. Credit cards are unsecured debt. If you used your credit cards to buy items, if you don't pay your credit card bill, nobody comes to take back those items or the food or those items that you bought with the credit card. So in a Chapter 7, to the extent you have assets, they will be sold to satisfy your debts. And then any debts that can't be satisfied will be completely discharged. A Chapter 13 bankruptcy is a little bit different. In a Chapter 13 bankruptcy, the bankruptcy court creates a repayment plan. Any debts that aren't paid during the repayment plan get discharged at the end. So for example, let's say you have a mortgage and you've been paying your mortgage but got hit with some kind of emergency financial payment and you weren't able to pay your mortgage, right? And you needed to take care of this financial emergency, but now you're back on your feet again, right? You're getting your Social Security. Maybe you have a small part-time job, right? There is now income to be able to pay the mortgage. What would happen in a Chapter 13 bankruptcy is those past due payments would be put into a repayment plan that would take 3 or 5 years. So imagine if you missed 6 months of payments, but you now have 5 years to pay them off. That is much more feasible and a great way to save your home. In a Chapter 13 bankruptcy, secured debt, like a mortgage, gets paid off first. Unsecured debt will get paid off, but maybe not fully. And that's why it's unsecured debt. They may not get paid, right? But there will still be, if you make all your repayment plan payments, then you will get that discharge at the end of the 3-year or 5-year repayment plan period. So who should file a Chapter 13 is the person who is able to catch up given enough time, right? Also, a person who owns a home and has substantial equity in the home should not file a Chapter 7 because the trustee can sell the home to satisfy the debts. So it's really not appropriate for someone who has substantial equity in their home. Now, I know that bankruptcy, the things I discussed, it might be a lot of unfamiliar words and maybe raise a lot of questions. I will take your questions at the end, but just know this is a complex topic that we're addressing today, but that bankruptcy may be the right answer in some cases. Oops. The next area I want to talk to is reverse mortgages. And like with bankruptcy, I want to say, please don't listen to those late night TV commercials. Again, reverse mortgages are appropriate in some cases. Now, while a person does become eligible for a reverse mortgage at age 62, it is not a great idea for a person who is as young as 62. Thankfully, we are all living a lot longer than when the reverse mortgage was created. So really the current guidance suggests that it's really best for those over 70 or 72. How does a reverse mortgage work? In a reverse mortgage, well, let me start with a regular mortgage. In a regular mortgage, each month you make your payment and your debt decreases, your debt gets lower, and your equity, the amount of the home that you own, increases. Well, with a reverse mortgage, it's the opposite. Each month, your debt will increase. The amount you owe to the bank gets bigger, and the amount of equity in your home decreases. Now, the good news is you won't have to pay it back, most likely, because a reverse mortgage gets paid upon death. So there are 2 ways people use income from reverse mortgages. Sometimes a person will use the income from a reverse mortgage to live on, and it can be structured as a monthly payment for a certain number of years. Sometimes a reverse mortgage is structured as a lump sum payment at the beginning. Sometimes a reverse mortgage is used to pay off a current loan so that the person never has to make a mortgage payment again, but no longer has equity in their home. So one thing to note is that you must be able to afford your property taxes and homeowners insurance if you get a reverse mortgage. So if your income is very, very low, this could be a challenge to prove that you can afford the taxes and insurance. Once again, if that is the case, definitely call us to see if there are other benefits you might be entitled to increase your income. A reverse mortgage is really designed for someone to stay in their home, but they will use basically all of the equity in that home to be able to stay there. So some people tell me, well, I want my home to be an inheritance to my children. And that is a beautiful and wonderful thing. However, it is more important that you have a safe, comfortable, and affordable place to live. And so if a reverse mortgage is right for you, and it's a home you can stay in for the rest of your life, then a reverse mortgage may be right for you. So again, figuring out what your income is, what your needs are. These are certainly areas that CJE can help you assess before diving into one of these things like reverse mortgage or like bankruptcy. So what do we do now? The legal help desk is a great place to start. And I say it's a great place to start because we can have a conversation and figure out what your needs are, what your goals are, and what values are driving your decision. We can help you navigate legal and financial questions. Where appropriate, I can guide you to outside legal support because directly at our legal help desk, we at this time do not do any direct litigation. However, I've got lots of connections and I can certainly provide support in that way. Also, I do provide some direct legal services like assistance with wills and powers of attorney and things like that, which are outside the scope of our discussion today. And also I can help with budgeting. If you've never made a budget, it is eye-opening. And I don't use any fancy technology things to make a budget. I use a pen and paper and a list that we've created at CJE to help people think about their budgets. And it's a great way to start to think about, is this a good place for me? Is my home a place I can stay? Can I afford to make modifications to my home? Does it make more financial sense for me to go elsewhere? All of those questions are things that we can certainly address. So also our legal help desk is available for continued support. Many help desks are only available sort of as a one-stop shop. You can come in for a 30-minute thing. That is not how we run. So you're welcome to call for continued support. And the biggest thing that I think is helpful about the legal help desk is that we're connected with all the other CJE services. As I said at the beginning, it's very easy to talk about things like reverse mortgages and bankruptcies when I'm not the one trying to actually think about my own home and these needs. And sometimes that can bring up just a lot of thoughts and feelings and emotions. And we have the support for that too. And so I just want to say our legal help desk, along with our counseling department and all of our other great departments at CJE, can be reached by calling our main number, which is on your screen now, 773-508-1000. That is the end of my presentation. I do see that questions are starting to come, so I'm gonna let Roseanne start to, oh, I see in the chat maybe.
Yeah, so I'm just trying to encourage people to put some questions in. We haven't had any questions. So if anyone does have a burning issue or a question that you want to ask of Tamara, please take this time now. So you can hit the Q&A button at the bottom of your screen and type a question in there. You can select that your name is not shown, that you'll be anonymous, so no one else can see what your question is. So we can give a few minutes to see if any questions come in there.
In the meantime, I just thought I'd also mention another area that I've seen some people coming in to see me recently is really about paying bills and understanding bills and getting confused, maybe if a bill got turned over to collections or if it's a medical bill. I mean, how many times if you are on Medicare, do you get a document that says this is not a bill? It's like, well, what is this? Why are you sending this to me? And so that is certainly an area that we can help navigate as well. Understanding your finances and your bills and paying them and getting organized is certainly an area to help with.
So there is a question now, and the question is, can you use your own attorney?
So here's the, I'm not sure exactly what the question is getting to. Feel free to write a few more details in there. But I do want to mention that attorneys are sort of specialized the same way doctors are. So you wouldn't go to, a cardiologist, a heart doctor, if you broke your arm, right? That just wouldn't be a good fit. There are also attorneys who are generalists, right? Who do dabble in a lot of different things. So depending on what your specific legal question is, you may be able to go to your general lawyer who you've asked questions to over the years. That may be fine. Or you may need a specialist. For example, if there's a complex tax question involved, you may want to go to an attorney who really specializes in taxes and accounting, the same way you might want to go to a medical specialist.
I'm guessing that answered that question very well. Thank you. Another question is, can I get help with a legal program with my home? I'm HOA. Is that Homeowners Association?
Homeowners Association. Yep. Wow.
Snow removal issues leaving ice.
Absolutely. This is a very common problem, that an individual homeowner has some kind of disagreement with their homeowners association or their condo board. Your condo board or homeowners association may have a document, a declaration, something that might govern the process. So it's super helpful if you have that document, but you should absolutely give me a call and we can see how we can navigate it for you so that you can have a safe winter getting in and out of your home, and getting to your house. Condo boards are, especially in really big condo buildings, can be challenging. And sometimes it's just a matter of getting some confidence, and knowing what questions to ask, to get the confidence to go to the condo board meeting, and have your questions prepared. That can really help navigating condo issues. But I would be happy to review your condo declaration or your board or minutes or however your condo works, and see how we can help.
I'm just marveling as you're talking, Tamara, just the fact that we have this service available at CJE. For speaking as a longtime staff member, I've been with the organization over 15 years, just to think that we have access to this wisdom and logic and to your, the benefit of the legal help desk. Just to know you're on board is wonderful.
Thank you. I will say in the winter months, a lot of people might be seeing family or getting together with family, and it might be a good time to talk to family about things that might be concerning to you, things about aging, things about finances, right? And finding that comfortable, quiet time to approach that. And certainly if they are legal questions, if you want to come in with your adult children, you are welcome to do that. Certain things I would want to talk to you individually about, and certain things I am happy to meet with the family. There's just a lot of support and resources available. And sometimes people who I speak to, they're relieved to know that there is such a support. But CJE has been around. We're coming up on our 60th year, which is very exciting. And there's just so much support available. And so I just encourage you, if you're on the fence, you're nervous about something, reach out and let's see what we can do.
Now, you haven't really talked much about end of life decisions and those kinds of issues. I know it's not the focus of our program today. We've had you come and focus on that issue in other programs, but that also is something that you're available to help with.
Absolutely. And I like to think about healthcare decisions. The big question I'll leave you with on that is, can I live with that? What are decisions that might affect my life, my actions, my desires, how I live my life? Some people think advanced care planning is really a focus on how I want to die or what happens when I die. And I think advanced care planning is actually much more about how I choose to live and experience my interactions with the people around me, with my home, with my medical professionals. On our website, on our legal help site, on our legal help desk website, we have a document called the CJE Guide to Healthcare Advance Directives. And if you're starting to think about these things, check out the document. You might think of some questions you want to ask. Might be a good way to start.
It really triggered my thinking to mention that when you said people are getting together with their family. This is the time to have important conversations, and we're always encouraging folks to put these things out there. Engage your family in these conversations, whatever they are. The finances, the future planning, end of life decisions. There's so much that we need to be able to talk to and about with our family and loved ones, with friends, with whoever are going to be involved in it, and whatever our support system is, whatever it looks like, because every support system looks different. But being aware and thinking who's going to be there for me and who can help me with these decisions. Wonderful. Is there anything else, Tamara, that you can think that you definitely want to add today?
So one other thing, there's a question here, is there a video available of your presentation about end of life decisions? There isn't right now. However, there are going to be more upcoming talks around February, March, and April, those months. So definitely keep your eye out for CJE emails about those topics. And you're also just welcome to come in and see me and have a conversation. It doesn't have to be, I'm ready to sign my documents today. It can be, I need help understanding what these documents are and what they mean. That could just be a time. Luckily, I don't have to bill my hours. That is a delightful part about working for CJE. So I am able to meet with you even if you're not ready at that very moment to go forward. The other area I would say to be aware of, especially now that we're in December, is there are scams everywhere. They're calling you, they're emailing you, they're sending you snail mail. The scams are out there. There's a lot of great information available about scams. We do talks about scams. If you're wondering if you've been scammed and what to do about it, we have information about that too. So that's a pretty hot topic that really I hear about a lot.
Absolutely essential issue. And Tamara, do you have a wait list right now?
Right now, actually, there is great news, which is that our legal help desk is expanding. We are hiring an additional full-time staff member starting in 2 weeks. So I believe by January, we will not have any wait list. Right now, it might be just a couple weeks if your matter is not urgent. It might be a couple weeks until we get you in to create or draft documents, things like that. But after that, we're onboarding someone new. It's very exciting, and a paralegal to offer a lot of support. So there should not be any wait list coming up after the next couple weeks.
That's remarkable. And we do have the question, can you post your phone and email again? Because of course, with you mentioning there is no wait and you're free and available, how do people get a hold of you? If you could put that out there. And then again, I just want to, yep, there we go. So everyone can see that. And then I'm just going to start to wrap us up today. What a great program. Thank you so much, Tamara and Rachel. I want to be sure to mention that, again, we're going to send this PowerPoint presentation to anyone who was in the program today. We'll also, as you're signing out of the program today, you're going to get a pop-up on your screen. There's going to be a program evaluation. We really do ask that you fill out that program evaluation today, especially because we need information for a grant. So even more than on other program days, if you could take a few minutes, fill out that program evaluation, give us feedback on what you got out of the program today. It really would be very helpful to us. as well. I always need feedback. I always need direction. I'm open to ideas. What can we do with these monthly programs? So after you fill out the evaluation, after you leave, be patient with me. We will send a follow-up email. We will send you the PowerPoint. We'll send you a link to the recording. But basically, all of these Insights on Aging programs are at the CJE SeniorLife website, the Counseling Services page, and there's a tab for Insights on Aging recordings. So hopefully not too hard for you to find us. And with that said, I think we can wrap up our program for today.
Thanks for coming, everyone.
Thank you.
Thank you both for presenting. So interesting.